Welcome to today's webinar. I'm Ron Pearson, a 1985 School of Public Health graduate of the Environmental Health Sciences program and a member of the SPH Alumni Society Board. I will be moderating today's session. Thanks to all who are joining us live today, as well as those of you who are catching the recording afterwards. And thank you to the SPH Alumni Engagement Committee for helping to plan this webinar. In a moment, I will introduce Joelle Lester, today's presenter, but before we begin, I'd like to share a few updates and housekeeping notes. Health in All Matters is a 10-episode podcast series produced by our school to bring more understanding of public health challenges across the globe and close to home. We include expert voices from our faculty and their colleagues around the world. Our premier series focuses on COVID-19 and the many issues it brings into question, such as transmission and prevention, life in a pandemic, loneliness and mental health, and the medical supply chain. You can find our podcast on our website or subscribe on Apple Podcasts. Sorry about that. For those joining us in real time, questions are welcome and you may submit them at any time. Our audience Q&A will be held at the end of the hour. Please type in your questions by clicking on Q&A, not the chat button at the bottom of your screen. We will get to as many questions as time allows. And we will be recording this webinar and encourage you to rewatch it or share it broadly after the event. And now for today's topic. With the rapid rise of youth use of flavored e-cigarettes and in the wake of alarming reports of vaping-related lung injuries, the public health problems associated with flavored tobacco products are now both acute and pervasive. This webinar was planned before the start of the pandemic, and yet the content is still relevant and will also address how effective e-cigarette regulation is important in the context of the current pandemic. I'm pleased to introduce today's presenter, Joelle Lester. Joelle is the Director of Commercial Tobacco Control Programs at the Public Health Law Center. She leads a team of 15 attorneys working to support tobacco control policy change throughout the United States. The center does this by providing legal technical assistance to public health professionals and advocates, developing resources on the most effective legal and policy measures to reduce the burden of disease and death caused by tobacco use in the U.S., and providing strategic leadership around bold policy options to end the tobacco epidemic. Joelle, we're so happy you're able to join us today, and please take it away.
Great. Thanks so much for that kind introduction, Ron. I'm just going to wait until I get control of the slides. Okay. Oh. All right. So as Ron said, I'm going to be talking about restricting e-cigarettes and flavored tobacco products. And I have adjusted the presentation a little bit to put it into context with what's happening right now. It actually feels like a long time ago that we initially conceived of this webinar because so much has happened in public health sense. Just first, briefly, for those of you who aren't familiar with us, I wanted to introduce you to the lawyers and policy analysts at the Public Health Law Center. This is just the commercial tobacco control team. We work nationally, and we have significant programs also for the state of Minnesota supporting grantees working on tobacco control policy change, as well as in the state of California. And then we have a national program and a federal regulatory program. The tobacco program is only one of two programs at the Public Health Law Center. We also have a group that works on healthy eating and active living law and policy. And we do hire research assistants who are students all year round, often law students and also MPH students. And so if there are any students listening and you're interested in a part-time job, contact me at the information at the end of the slides. So just to briefly explain legal technical assistance, we are a grant and contract funded organization. We don't provide direct representation and we don't lobby. What we do is research and analysis to support public health policy change. So we do that in sort of broad topics. We develop publications and webinars that are available on our website. And then we also do individualized legal technical assistance. So if a jurisdiction is interested in tackling a particular problem related to tobacco, they can call us up and we can help them figure out what authority they have and what the best practices are to address that problem through policy change. We have long worked to ground our work in focusing on the social determinants of health, and I think we can all agree that the need to do so is more important now than ever. It's always been important, but I think we're feeling it more acutely, especially racism as a social determinant of health. But this is something we work hard at the Public Health Law Center to ensure we're centering equity in all of our work and delivering the health benefits of policy to all parts of the community. And then this is just our little visual for making sure that policy is designed to reach everybody, and that doesn't mean delivering the same thing to everybody, but meeting everybody's needs. So today I'm going to talk a little bit about the health impacts of e-cigarettes very briefly, because I'm sure you're all aware since it's been so much in the news in the last probably 9 months. We'll talk a little bit about the intervening events, so the things that Ron referred to, including the vaping, lung injuries, and skyrocketing youth rates, and how that has affected regulation of e-cigarettes. And then I'm going to walk you through, the federal authority to regulate those products and what states and locals can do and sort of what people are doing. And there's some gaps in what the FDA has been doing that states and locals have sought to fill. And then we'll just talk a little bit about chronic disease prevention in the pandemic context. So as you are probably aware, e-cigarettes are a relatively new phenomenon. They came on the market probably in the early 2010s, 11, 12, around there. And the product category has evolved quite a bit. And so you can see on the left, there are e-cigarette is a category that covers products that can look very different. But what they tend to have in common is they deliver nicotine to the user, and they are often flavored. And at first, there was very little known about what was in these products, in part because the manufacturing was really diffuse. It wasn't like the big tobacco companies were making them. It was a market with a lot of small companies and a lot of overseas manufacturing, and then no regulation. So there was not even necessarily consistency within one brand of e-cigarettes at first. But what we know now is that there's a lot of things in those products that are very harmful. Significantly, nicotine is harmful all by itself and of course addictive, but then also the flavorings, for example, even if it's a flavoring that's added that might be generally recognized as safe to eat, that does not mean it's safe to inhale. And so the little popcorn icon you see there is to give the example of when manufacturers of microwave popcorn were adding that butter flavoring to it and inhaling it, that creates its own harm to people. So you can't assume that just because something can be eaten, it should also be inhaled. So we've learned a lot about e-cigarettes. And as we've learned, the concern has grown. So I think initially people were really enthusiastic about the potential for e-cigarettes to be used as a less harmful alternative to cigarettes, or even perhaps a cessation aid. And what we've learned is that those hopes have not panned out, or the research doesn't support them yet. That doesn't mean that they never could, but so far that is not supported by research. But we do know that on the flip side of that, they are driving youth initiation to tobacco products, and that many youth are then transitioning from e-cigarettes to cigarettes or other tobacco products. And so the US Surgeon General actually in December of 2016 issued the first report on youth and e-cigarettes. And then this is very recent. The current Surgeon General issued a health advisory cautioning about the problematic youth uptake of tobacco products because of e-cigarettes. This gives you just a little bit of a sense of the growth in just 3 years of youth use. It's really significant. This data is specifically Minnesota data, but this is mirrored in other states around the country. And it's true even in states where, you know, they have done significant tobacco control policy change to reduce prevalence of more conventional tobacco products, and then they're losing all the ground that they've gained because of e-cigarettes. A lot of this is driven by the flavors in e-cigarettes. This is an ad campaign from the California Tobacco Control Program and the California Department of Public Health. And I think it really resonates when the e-cigarette companies often argue that they're not targeting kids. Actually, the flavors are preferred by the adult consumers. But when you take a look at what those flavors are, and there are some really crazy flavors, if you are unfamiliar, you might check out. I would have said go into a vape shop because that's what we did as a field trip to learn about it, but you shouldn't be going into vape shops right now. So maybe just looking online, but it's, you know, there's a lot, there's cotton candy, there's, I don't know, unicorn sparkle or things like that, which are clearly designed to appeal to children. This, as you probably know, is a page straight out of Big Tobacco's playbook. And we see a lot of that with the e-cigarette companies. And in fact, in some cases, as in Altria's acquisition of the controlling share in Juul, they are the same company now. So there was concern, and maybe even people who were hopeful that there would be a benefit to e-cigarettes, ideally were applying the precautionary principle and being careful about them. I would say the precautionary principle is always important in public health regulation, but especially when you're dealing with an addictive product, because if you leave it unregulated and then realize there's a harm, it is much harder to roll back that harm. Then starting about last August in 2019, we started seeing the outbreak of these mysterious lung injuries that were associated with the use of e-cigarettes. And so this is a visual from the CDC's website. And I'm sure you recall there was a lot of news coverage of this event, or these events. It reached all 50 states eventually, with many people being ill and people dying. And eventually they identified the vitamin E acetate as being the problem in some of these e-cigarettes, but it also sort of illustrated how little we know about what's in these products. And it's difficult to get your hand on it when the product category isn't adequately regulated. So there was a government response, a policy response to the lung injury situation. The lung injury situation seems so, it's like such a crisis then, and it's really put into perspective, I think, by the pandemic. But I think that the government response was mixed. So there was a federal response. The president had the FDA issue a partial and temporary restriction on the sale of e-cigarettes. And so it was partial because it only covered some e-cigarettes, and then it was temporary because those e-cigarettes could still apply for a marketing order. And so that was, I think, an insufficient response to fully address the problem. A lot of tribal communities took action, and they tended to do permanent policy change. So they would develop an ordinance that prohibited the sale of e-cigarettes or the sale of flavored e-cigarettes on the tribal land. And then there was a state response. And what we saw from the states were executive orders. And this was tricky because the authority for executive orders varies state by state. And in many states, the authority delegated for executive orders doesn't seem to contemplate this kind of health crisis. It's actually more for an infectious disease outbreak or a natural disaster, typically. And that's just a general statement. You would have to look at every state, which we did a lot of that actually, because many states contacted us. They were interested in seeing what authority they had to act and what they should do. And there are some downsides to the state response with the executive orders. They're also temporary, and that's just the nature of an executive order. It's just to patch it together until the legislative body can get back together and develop a more permanent policy solution. They also tended to focus specifically on e-cigarettes, and e-cigarettes are a big problem, and so are other tobacco products, for example, cigarettes. And so you ended up with sort of a situation of taking flavored e-cigarettes off the market maybe, but not addressing equally or more harmful tobacco products that were also on the market. So it was sort of a tricky situation. And the tobacco industry was suing the states that had issued those executive orders. And so then you end up with a huge consumption of resources developing and defending an executive order, which is only a temporary policy solution anyway. So it was a mixed bag, I think, for the states. The other intervening event, in addition to the lung injuries, was the skyrocketing youth vaping rates, where I think that suddenly people, even people who had been holding out some optimism about the benefit to addicted adult smokers, became really concerned about how many kids were using. And you saw that in the Minnesota slide, how the prevalence rates jumped for youth in Minnesota in just 3 years. And that was true nationally as well. And so this caught the attention of a lot of people, not just the Surgeon General, but also the White House and governors across the country and parents. And part of this is because I think in many states, prevalence of smoking was low, and smoking has tended to become localized in certain communities and less so in others, whereas e-cigarettes do not kind of follow that same trend. So what you saw, I think, were parents who didn't worry as much about their kids smoking suddenly realizing their child was addicted to e-cigarettes. And then because of the sort of lack of information and the highly addictive nature of some of these, especially Juul, that the kids were struggling with addiction. And then unfortunately, cessation aids for young people have not been adequately developed and tested, because that's very tricky to do. And so you have these very addicted kids without an established medical protocol to support their quit attempts. So people generally, I think, freaked out about this when we realized what a big problem this was. We started getting a lot of calls from schools wanting to improve their tobacco-free school grounds policies, things like that, because people were just dealing with this crisis at every level. So that's setting the stage with the problem. And then I'm going to just explain a little bit to you about how tobacco products are regulated to give you a sense of like what the options are for restricting e-cigarettes and flavored e-cigarettes. So if you've worked at all in tobacco control, you are aware that it has long been a state and local issue. That the first smoke-free laws, well, all smoke-free laws actually, started local, went to state, you know, all of that sort of policy change and the changing of norms around smoking was policy change at the state and local level. And the federal government just had a tiny role in that until 2009. So in 2009, Congress passed and President Obama signed the Family Smoking Prevention and Tobacco Control Act. And it gave the FDA authority over tobacco products. Now you may recall, I'll just pause this 1 second. In 1996, under the Clinton administration, the FDA tried to regulate tobacco products as drug delivery devices under the drug authority of the FDA, and that was ultimately struck down by the US Supreme Court in 2005. And so Congress had been trying to sort of give that authority where the court had found it lacking to allow the FDA to regulate tobacco products. So the act initially gave immediate authority just over these 4 tobacco products: cigarettes, cigarette tobacco, roll your own tobacco, and smokeless. But then importantly gave the FDA authority to deem other tobacco products to be subject to its authority. So this is just a little chart from one of our publications sort of showing that the FDA regulates all these products now, but not everything applies to every product. So there are some things that are uniform, like the minimum legal sales age, which importantly didn't apply to e-cigarettes until 2016, but it does now. And then because we're interested in flavors on this webinar, I just want to point you to the bottom row. The prohibition on characterizing flavors was in the Tobacco Control Act. Congress directed the FDA to prohibit characterizing flavors in cigarettes except for menthol and tobacco, but didn't extend that flavor prohibition to other tobacco products, and just ordered the agency to study the issue of menthol and take action based on its determination. That was a political compromise that makes no sense, because menthol was the most used, widely used product. It's much more used by African-American smokers, so it drives disparities. And it was a negotiated concession with the industry to get the law passed that has had more than a decade of repercussions now. So in 2014, 2014, the FDA finally proposed a rule to deem other products subject to its jurisdiction, and it became final in 2016. And you can see here they sort of established some rolling dates for when different restrictions would apply. So these are all things then that states and locals wouldn't be involved in because the federal government is taking care of it. But some of them have been pushed out again and again. And actually the bolded line, that has been postponed several times, and then a court said that FDA had to review products before letting them be marketed by May 20th. And then now that's been pushed back because of the pandemic. So even getting the authority into place has not produced immediate results for regulating e-cigarettes. So something else the Tobacco Control Act does is it sort of divvies up authority to regulate all tobacco products between the federal government and the states. And so these are 3 clauses in the act. The preservation clause sort of preserves authority to the states. The preemption clause says states can't do something, states and locals. And then the savings clause sort of reiterates what the states can continue to do. And this is important because the states have done a lot to try to fill gaps with federal regulation and deal with the slow pace of federal regulation, but they can't do everything because the act says some things just. So generally speaking, you can see on the left, the FDA can do tobacco product standards. It can limit nicotine yields, can prohibit flavor constituents, for example, when it gets into how products are manufactured, but they can't pass smoke-free laws, they can't tax, and they're not allowed to ban a whole class of tobacco products. And then if you flip to the other side, you can see states and locals mostly can't do tobacco product standards, although there may be some exceptions to that, but they can do a bunch of other things to try to get these products out of their communities or to reduce the harm of those products. So that delineation of authority sort of points us to the policy options at the state and local level to either go further than what the FDA is doing or to act when the FDA hasn't. So flavored tobacco restrictions are a very important policy option that states and locals retain. I will just say not every local can do things that the state can do. It depends on what authority the locals are given in the state. In Minnesota, for example, locals can restrict the sale of flavored tobacco products, but they can't tax. They don't have taxing authority here. But in other states, locals can apply their own tax on tobacco products. So flavor restrictions can be done here in Minnesota and in many communities, and they have been. The flavors in e-cigarettes have prompted a lot of interest in flavor restrictions, but the better flavor restrictions apply to all tobacco products, because what you don't want to do, as we talked about before, was get all the flavored e-cigarettes off the market but leave menthol cigarettes, for example. You don't want to drive addicted kids to using other even more harmful or differently harmful products. But I think that because the flavors are kind of so egregious in e-cigarettes, they have been the focus of a lot of policy change, and sometimes it just focuses on e-cigarettes. So for example, just this week, the governor in Montana proposed using regulatory authority to prohibit the sale of all flavored e-cigarettes in the state of Montana. The visual on the top right, those are jewel pods. So there's flavored but more limited flavor, and then you can see some of the sillier flavors down below. So the other reason for the focus on this is because many kids say they started smoking or vaping because of flavors, often with the misperception that they're just inhaling a flavored water vapor. I guess one thing I'll add about this is these policies sometimes exempt menthol, which is a terrible idea because all of the public health evidence and research shows that that is a really harmful product and drives disparities, as I mentioned. There are many jurisdictions now who are passing these ordinances and including menthol, and the tobacco industry tends to sue those jurisdictions. And for example, just filed a lawsuit against Edina for their flavored tobacco product sales restriction. So this, just to give you a little bit of a sense of how this has evolved, New York and Providence, Rhode Island passed flavor ordinances back in 2012-ish, and both were sued and survived those litigation challenges, but they didn't include menthol. The city of Chicago in the middle there, they passed a flavor ordinance that included menthol. They got sued, survived that. That gave other jurisdictions courage. And you can see on the right, San Francisco actually banned the sale of all flavored tobacco products completely in the city of San Francisco. And then down below there is Duluth, which is another national leader on this issue. St. Paul, Minneapolis, Duluth, I think St. Louis Parks, a lot of jurisdictions have taken this step, which is very exciting and important to protect health. And they've learned as they've gone about sort of what works and what doesn't for implementation and enforcement, which is also really important. Another option for restricting e-cigarettes and other tobacco products is location-based policies. So this can be, no tobacco retailers within 1,000 feet of a school, for example, none within less than a mile of each other, a cap on the total number in your jurisdiction, or you can either limit it to one kind of retailer. We see this a lot where they'll say no flavored tobacco products except for in tobacco only, adult only retailers, so like a tobacco shop. Or you can say certain kinds of retailers can't sell. So some jurisdictions have prohibited the sale of tobacco products in pharmacies. And those have been pretty popular. And some pharmacies just go ahead themselves and say they're not going to do that, like CVS did a couple of years ago. Fun fact though, CVS got a lot of attention for that, but Target had decided not to sell tobacco products many years before CVS, but just didn't get out the hype. Another option is raising the minimum legal sale age. This one, you might think, why would we do that now? Because the federal government just did that a few months ago, and that's true, they went to 21. And then just a couple of weeks ago, the Minnesota legislature also changed the state law to go to 21 to be consistent. And so locals are changing their ordinances now also to be consistent. But something to consider is, initially, the FDA wasn't allowed to raise the minimum legal sales age over 18. And so states and locals around the country were raising it to 21. And the evidence is that it's much less likely for someone to start smoking if they haven't by the age of 21. But actually, they're even less likely to start smoking by the age of 25. If that's the minimum legal sales age, there was a big report from the Institute of Medicine on this. And so what's an option, although it hasn't come up yet, would be that a jurisdiction would follow the science there and say, actually, we're going to raise the age to 25. We're going to go beyond the T21. One other thing, I guess, is you could do that for just some kinds of products too, for example, flavored products, or you could do it for all products. Tax and pricing policies are a very effective way of reducing initiation and consumption. Discounting and coupons are a major promotion tool of the tobacco industry. That's always been true of big tobacco, and it's definitely also true of Juul and other e-cigarettes. And so some jurisdictions raised the taxes on tobacco products. In 2016, the state of California, for example, increased their tobacco tax by $2 a pack of cigarettes and directed a lot of that revenue to the public health department, which was awesome and brilliant, and to tobacco education and prevention campaigns. We mentioned that in Minnesota, locals don't have the authority to raise the taxes, but they can establish, for example, a minimum pack size and a minimum price to try to drive up the cost, because we know that youth are very price sensitive, and that can really diminish their initiation. So advertising and marketing restrictions are a tricky and important part of regulating tobacco products. So one thing we know about e-cigarettes is that they tend to use a lot of the same marketing strategies that big tobacco has always used. So in addition to sort of the messaging about being young and free and cool, there's also a lot of celebrity endorsements, or in the social media age, there's social media influencers who are used to promote the products on Instagram, for example, other platforms that I'm sure I've never been on before, but YouTube videos, there's a lot of, there's product placement at award shows where celebrities, the camera cuts over to Leonardo DiCaprio and he is vaping. So it's a lot of sort of the same stuff that we've seen, and a lot of it is really clearly targeted to kids. So the challenge though is that the First Amendment protects a lot of commercial speech, more so in recent jurisprudence than, you know, decades ago. So initially, I think some people would say the First Amendment wasn't intended to be protecting commercial speech so much as individual and political speech, but the case law has very clearly established that that companies are entitled to free speech protections as well. And this makes it really tricky to restrict advertising and marketing. And so there are some of those restrictions in law. They don't apply typically to e-cigarettes. There's a couple of old federal laws that you know, don't prevent cigarette advertising on television, for example, but it doesn't apply to e-cigarettes. And then some of the advertising restrictions for cigarettes are actually from the Master Settlement Agreement. So branding and marketing at sporting events, for example, or advertising in youth-focused magazines, that's prevented, but it didn't have to withstand a First Amendment challenge because the Master Settlement Agreement isn't a law restricting speech, it's a negotiated settlement of litigation. And so it would be hard to extend those to e-cigarettes without a similar mechanism. And the tobacco industry uses the First Amendment as a shield for almost anything. So I mentioned the coupon and discount restrictions that have been very effective, and those are in place also in New York City and Providence, Rhode Island, who did those around the same time that they did their flavor restrictions and got sued. And in both cases, the industry was saying that the discount is communication from them to their customer, and so it's protected speech. The court struck that down, thank goodness, but it just shows you how much the First Amendment is used as a shield by the industry for all kinds of protective public health policies. This wasn't what I was planning on saying with the slide, but it's sort of a variation on the First Amendment theme is health warnings on products. So there's textual warnings on tobacco products, but when Congress passed the Family Smoking Prevention and Tobacco Control Act in 2009, they also required the FDA to develop graphic health warning labels, and many countries around the world have those on cigarettes, and they're effective for a bunch of reasons. They're more powerful and evoke a more emotional response. And when the FDA completed the rule, initially it was struck down by the court because of the First Amendment. And so the FDA has proposed a new graphic warning label rule, and that is also currently being litigated. So the industry uses the First Amendment as a shield in multiple ways to avoid restrictions. So another sort of option for communities worried about the impact of tobacco product use on kids and adults in their community is to just get rid of the tobacco products altogether. And this might sound kind of radical, and it really is it's a transition from thinking about controlling tobacco to really getting at eliminating tobacco. It's sort of deciding that you don't have to accept this toll of disease and death caused by this product. And sometimes people say, oh, you can't do that, it's a legal product, but actually it's only legal because we say it's legal, and laws can change. And so there are jurisdictions that have decided to go down this path. The city of San Francisco is pictured here again, but they are the ones who did the total ban on all flavored tobacco products, which means that applies to all products, all flavors, all retailers, no exemptions. So that's a pretty bold policy option. And they did not get sued, but what RJ Reynolds did was launch a ballot measure campaign to try to repeal that. And it was unsuccessful, even though they spent like 16 million to 1 million on their campaign, but the residents of San Francisco upheld their flavor restriction, which is awesome. The city of Beverly Hills, which may not be the most relatable jurisdiction, but it's certainly interesting, they were talking about a flavor restriction as well, and while they were talking about it, their mayor said, why do we allow any of these products to be sold in our community? They're just terrible for our community. And so they eventually passed an ordinance prohibiting the sale of all tobacco products, except they exempted, I think, 3 cigar bars. and they had one other weird exemption for hotel concierges. But mostly got all the tobacco product sales out. That law will take effect on January 1st of 2021. And so once they did that, then other communities started thinking about that as well. And the town of Manhattan Beach in California passed the same sort of law, except for they didn't include any exemptions for any kind of retailer. So on January 1st of 2021, all tobacco product sales will be prohibited in Manhattan Beach. So I think that what's interesting about this is sort of, I think as people have learned more about not just the harms of the products, which we know a lot about now, and know more now about the harms of e-cigarettes in particular, but also, you know, sort of how much the industry knew about the harm and misrepresents or markets it in a way that is disingenuous, and really enthusiastically targets young people to get them addicted to these products. That tends to make people change their thinking a little bit. And then I would say part of that too is the pretty egregious targeted marketing towards certain communities. So menthol in the Black community I mentioned, where there's cultural appropriation and a real push for those products in certain neighborhoods and more discounts in those neighborhoods and more retailer density. And I think that what we've learned from some of the national African-American tobacco prevention advocates is that when you explain some of that history of targeting by the industry, that is very mobilizing for members of the community to say, no, we don't want to participate in that, and that our health matters. So this is, I would say, sort of at the vanguard kind of policy option, but that we're seeing more and more interest in it. Variation on the theme, and then we mentioned this, or I mentioned this a little bit earlier, is when a jurisdiction is decides to prohibit, but they only prohibit e-cigarettes. And for the same reasons that that's not a good idea to do in an executive order, it's very problematic in this case too. That it's important to think through the unintended consequences of taking one addictive product off the market and leaving others. And e-cigarettes seem to be much more harmful than people realized at the beginning, but cigarettes are extremely harmful in more in different ways. And so you wouldn't want to drive people to menthol cigarettes. And there is evidence showing that if you take some flavored products off the market, people switch to the flavor that's remaining. So for example, Juul took mint pods off, but left menthol, and then unsurprisingly, the mint users just switched to menthol Juuls. So it's just something to think through. And then something else I would add, and this is probably true for all of these policy options, but it's especially true for this one, is the importance of sort of public engagement and cessation support being made available to folks. That the restriction is focused on the industry, either the manufacturers, distributors, retailers, and support should be focused on the addicted users. So giving people information and then access to cessation is really important to ensure that the public health benefit of the policy is maximized in the community, and that there isn't any sort of, that would prevent, or I would say that would reduce the risk of an illicit market arising, promote health in the community, and the success of compliance with the law by the retailers if there's a strong cessation component. One other thing I guess I'll just mention for all these policies is that it's also that focus on the industry instead of the user is also important to ensure that you don't provoke other kinds of threats to public health by the way your policy is designed. And so one thing that you see a lot in policies, this is true for usually for sales restrictions or point of sale, is that there's penalties focused on the purchaser. So if you have a minimum legal sales age, for example, and then there's criminal penalties for the young person who purchased it or used it or possessed it. So we call those PUP, purchase, use, and possession penalties. And those are a bad idea. They don't promote compliance with the law nearly as effectively as penalties for the retailer, but they also give rise to unequal and unjust enforcement of laws and additional interactions with police. And you know, as public health folks, we need to confront that racism is a public health issue and be very careful that we're designing policies in a way that promote health for all and don't ignore the ways that we intersect with these other issues. So, you know, policing and police brutality is not my issue area, but I can't ignore that any criminalization of behavior in tobacco control is going to intersect with that, also a public health issue. So now we're in a pandemic. So I think initially when the pandemic sort of unfolded and we all collectively kind of freaked out, there was a real sense in tobacco control, and we're, as you know, there's a whole range of chronic disease prevention issues, and that sort of goes immediately to the back burner, and everyone's focused on the infectious disease outbreak because that's the more acute threat to health. And that happens a bunch of ways. All the attention is focused there, money gets redirected there, staffing gets reallocated to the emergency response. That happened at the CDC, that happened at state health departments, local health departments. So it's both appropriate and a little bit of a concern, because chronic disease prevention has to be happening all the time to build the health resilience in communities. So when there is an infectious disease outbreak, where we can withstand it a little better. And of course, also investing in public health infrastructure is critical to being ready for an infectious disease outbreak. And then I think the other thing that's really been front and center in this current pandemic is how the disparities that we know exist and that we work on in chronic disease prevention are dramatically, horrifically exacerbated in a pandemic context. And I think we've seen that, especially for African Americans, you know, dying at much higher rates from the coronavirus than other groups of people. And there's a lot of reasons for that, but you know, we certainly see in our work a direct line between the predatory targeting of African Americans with menthol cigarettes and causing, you know, a host of health issues and premature death, but also making those individuals who smoke more susceptible to an infectious disease that's related to respiratory health. So I think for us at the Public Health Law Center, it doesn't make us want to reallocate our resources away from the work that we've been doing. It sort of makes us double down and think about how essential the chronic disease prevention policy change is all the time to be better prepared for the kind of crisis that we're facing today. So I think that's all I have for you. Oh, we have a lot of resources on our website, maybe too many resources. We're lawyers, so we're not exactly brief writers or speakers, but feel free to come check them out. We have on the left, you can see we have a 50-state survey of e-cigarette regulations, and it's a little clickable map. You can check out how to handle it. And publications about Joelle and policy options to rein in the e-cigarette epidemic with young people. It's publichealthlawcenter.org. And here's my contact information, and I'm very interested in hearing from you if you have any questions about any of this, but also if you are interested in a research position. We welcome public health policy students, and it adds a lot to the work that we're doing. So with that, I'll wrap it up and turn it back over to Ron for questions.
Thank you so much, Joelle. Again, we definitely have time for questions. If people have a question, please type one into the Q&A box at the bottom of your screen, not the chat, and then I will read them to Joelle and she can respond. So.
Oh man, I went back to the same thing.
Okay, here is a question. Can you talk about what the general public can do to advocate to their legislators about prevention?
Yes, and I will give you this sort of my general sense. I am not actually asking any of you to contact a legislator to ask them to vote a particular way on legislation, of course. But I think it's helpful to legislators to hear from people about their experiences with the product. So if you have realized your child was using an e-cigarette, or that their friends are, or if you hear from your children's teachers in school, I think those are important perspectives to relay to policymakers, because I think that one of the challenges with tobacco control generally is that with the sort of concentration of the problem in lower income and like lower education level parts of the community, is that that's not who the policymakers are, and so they have a sense that the problem doesn't exist anymore. And that's not really true with e-cigarettes, but I do think it's important that they are hearing from folks sort of about their actual experiences. And I think it's also really important to hear from people who have struggled with addiction, because this isn't a normal product. It's not just harmful, it's addictive and harmful. And that is a exponentially worse problem to try to solve on the back end. And it's much better to regulate on the front end. And so at the National Conference on Tobacco or Health, which happened to be held in Minneapolis last August, a teenager spoke about his addiction to Juul and sort of his experience with it and how it impacted him and his family. And it was very compelling for all of us who are working in tobacco control, but I think that kind of message is extremely compelling to decision makers too. And then I would also say that there's great federal data, the CDC has awesome data, and then the health department has great data, but it's also really important to gather local data. That's very important to policymakers. They're interested maybe that it's a national problem or a statewide problem, but they're much more motivated to act if they have information about, say, the school in their town, or the folks in their jurisdiction who are struggling with the issue.
Another question, it's a kind of a two-part question. I'm curious how the public dialogue around policy has been shaped by marijuana policy. I know that's a thorny issue. For example, growing public support for less restriction on marijuana and greater restriction on tobacco products.
Well, that's a great question. You're exactly right that it's sort of a mismatch right now with trying to get tobacco products out of communities while marijuana is pushing forward. I think there are also a lot of intersections with the concerns about the issue, because actually e-cigarettes are another good example of this intersection, because it's hard to know what is being vaped in an e-cigarette actually. And often there is THC in the vapor. I'm not saying like Juul sells it like that or anything, but it turns out kids are able to manipulate their products. And so, and then in a state where it's legal, then it's definitely possible that there's THC there. But so I think that, the kind of general prevention for tobacco can also be extended to prevention for young people taking up marijuana. And in a state like Minnesota, where recreational marijuana isn't legal, it's a little bit of a clearer picture. And where it becomes really muddy is the many states now who have legalized recreational use of marijuana, but they regulate it separately often. So it's not necessarily the same people. And so there's a real disconnect, I think, and it makes it difficult. For example, in a flavor restriction, I'm working with a jurisdiction in California, and they're interested in restricting flavors in tobacco and marijuana, but they're regulated differently, and we're not funded to work with them on marijuana policy change. So it's an unfortunate bifurcation, I think. And you're right, like kind of competing trends, with one becoming more accepted and one less.
Joelle, I have a somewhat related question. I've done quite a bit of work in the coffee roasting industry for control of these same chemicals for flavored coffees. And I'm curious, do you think that the press that was put out around that issue has impacted this at all, in terms of, okay, it's in coffee, so it can't be that bad for you kind of thing? Like, people may have that kind of lens put onto it?
Yes, definitely. I think it's coffee flavorings. And then I think it's also the description of a flavoring is like fruit. Sounds harmless, but it's not actually fruit. You know, it's a chemical additive that tastes like a certain fruit. But I think people have a real sense that's been promoted by, you know, the companies themselves, that it's just harmless flavored vapor, and kind of avoiding the issue that inhaling and ingesting are two different things. I do think that the popcorn lung example, people actually know what that means. Everybody, well, not everybody, but probably people of a certain age, so my age, are familiar with that health problem that was caused. And so when you explain that to them, that makes sense to them, that you inhaling and eating isn't the same thing. But I think that we're working against companies with really dramatic marketing and advertising budgets and sophisticated messaging. And, you know, so it's kind of hard to compete against that with our wonky public health facts and research.
Okay. All right, it looks like we have no further questions. So once again, thank you very much, Joelle. We really appreciate your time and the timely information. So have a great day, and thank you everyone for attending.
Thanks for having me.